Lee, and I'm a third-year medical student at UCF. Thank you for inviting me to speak with the GIN Network. I'm actually from Delaware, so I'm pretty excited about this, and I'm thankful for the opportunity. So my research was with Dr. Hayes at Tumors, Orlando, and she's a neuroradiologist, and together we compiled this case series describing the utility of synthetic MRI in the evaluation of pediatric CNS tumors. So to give some background, pediatric CNS tumors account for 20% of childhood cancers, and they're the leading cause of cancer-related death in children in the US. And so it's very important that we try to find improved diagnostic techniques. Currently, MRI is the diagnostic tool, but it's limited in its ability to distinguish different tumor types, as well as monitor responses in treatment. So we propose this novel method called synthetic MRI, which is able to generate multiple contrast-weighted images from a single acquisition. And it's also very unique in its ability to automatically segment water and myelin, which we believe can reveal new characteristics about the tumor. There are no health risks besides an additional 5 minutes in the scanner. And so we hope to use this tool to help characterize tumors and try to also distinguish tumors from other brain masses. A current challenge in diagnosis is differentiating progression of the tumor from pseudoprogression, which is more of a radiation-related inflammatory change that can mimic true progression of the tumor. And that's especially hard to identify, especially with high-grade gliomas such as diffuse midline glioma, which is a very aggressive and invasive type of tumor. So these are the hypotheses. We predict water and myelin can provide some unique insights to help characterize the tumors, and also that changes in water within the lesion can be used as a tool to evaluate for progression. This was an observational prospective case study of pediatric patients with CNS tumors at Tumors Children's Health in Orlando. The patients that were included were 21 years or younger, and they obtained MRI as part of their standard of care imaging. We added a brief 2D synthetic MRI sequence into the standard acquisition protocol and obtained the water and myelin maps from the software. We had 2 pediatric neuroradiologists interpret the scans, and we scanned 42 patients over the course of 6 months and observed changes over time. And we identified 4 unique cases where synthetic MRI was able to help us refine the diagnosis or reveal something new before that we didn't see in the conventional scans. So this first case was a 3-year-old girl with diffuse midline glioma. This scan was obtained after surgery, radiation, and chemotherapy from 1 year ago, and at the time she was on a biologic maintenance therapy. The tumor had infiltrated through the cerebellar peduncles, and there was some residual mass seen here in this prior study, so A and C, as well as in a follow-up study, B and D. These are the conventional sequences, axial T2 and axial FLAIR images. And you can see that there's an area of hyperintensity in the right thalamus. However, there's actually a infiltrating component of the tumor in the left thalamus, which is not very easily visualized on the axial FLAIR images. But with the myelin map, we can see that there's that component of the tumor in the left thalamus, and that becomes more obvious on the follow-up study 2 months later, where the arrow is pointing. You can see that there's some amount of growth or expansion of the tumor. And so we believe that these myelin maps could help us delineate the margins of poorly defined lesions and help monitor subtle changes over time. and maybe even help with surgical planning. In this second case, there was a 16-year-old girl with a history of a tumor from 8 years ago, and she had presented to the ER with sudden left-sided weakness. The conventional scans, such as T2 and FLAIR, as well as ADC, which is a measure of diffusivity, and MR spectroscopy, revealed findings that could either be consistent with a atypical glioma or a demyelinating lesion. However, on the myelin map, we had this very unique finding, which is this ring of demyelination. It's this thin, consistent, and uniform decrease in myelination surrounding the abnormal signal, which kind of gave us more insight into that this was actually a demyelinating lesion and not a glial neoplasm. And that sign was very striking to us because it looked different from what we see in high-grade gliomas, where there's ill-defined irregular margin of decreased myelination, and in low-grade gliomas, where there's a well-defined edge. And that is very remarkable when you compare it to this image here. So for this second case, ultimately, she was diagnosed with multiple sclerosis, and the immunotherapy resolved the lesion, which further reaffirmed that initial imaging finding. And this case reveals that perhaps the myelin maps could help us identify these demyelinating lesions early on and prevent invasive procedures such as biopsy, which is, in this case, what they were actually planning to do for her, since they had suspected that it was a tumor in the beginning. In this third case, there was an 8-year-old boy with a new intraventricular mass that was incidentally found. And you can see that in the left lateral ventricle here, there's that mass. And on the water map, we can tell that there's actually not much water in this tumor. And initially, they thought it might be a choroid plexus papilloma, but with choroid plexus papillomas, you would expect there to be an increased amount of water, but there wasn't. So this gave us a hint that it was maybe another diagnosis. And eventually, the biopsy revealed that it was a grade 1 meningioma, which is a very solid tumor. And this result was also correlated with this finding on the post-contrast enhancement, where we see a very vigorous enhancement, and that's seen with normal choroid plexus. So that also is able to confirm what we saw in the water map, where we don't actually see an increased amount of water. In this fourth case, there was a 13-year-old girl with diffuse midline glioma of the pons that was treated with radiation. And in the follow-up study, 1 month later, there was an increased amount of water in the tumor along the posterior aspect where there's more necrosis. And this shows us that possibly the water maps can help us identify areas of the tumor where there's more cystic or more solid, and monitor radiation-related changes over time. So these were the conclusions. As I said in the first case, the myelin maps can be used to delineate the margins of poorly defined lesions. In that second case of the tumefactive demyelinating lesion, we saw this very remarkable sign of a ring of demyelination, and that may help us in the future to avoid risky or invasive procedures. The water maps can also provide us more information, especially in that case where we did not observe water in the tumor, which helped refine the diagnosis where they initially suspected it to be a choroid plexus papilloma. And the water map may also help us monitor radiation-related changes. Some limitations to the study were that it was an observational case study, so we weren't able to control for the confounding factors. It was also qualitative, so the observations may have been subjective, and there was a small sample size for the specific tumor subtypes. So that may make it difficult for us to establish significant conclusions. Some future directions would be to broaden the number of MRI studies, and also to follow up on the 10 diffuse midline glioma patients to evaluate for the progression of the tumor, since some of the scans weren't done with synthetic MRI, like in the initial study or in the follow-up study. So there were few studies where we could see both the initial and the follow-up. We could also perform quantitative analysis on this data and also correlate it with other advanced imaging techniques, such as DTI, which is a diffuser tensor imaging that helps us visualize water tracks, which could possibly be correlated with the water map that we see in synthetic MRI. There's also a 3D synthetic MRI sequence that is pending FDA approval that we also hope to analyze for any additional features. So thank you for Dr. Hayes for her mentorship, and Dr. Chandra, who's the other pediatric neuroradiologist that helped identify the demyelinating lesion, Sweta, who helped me with some of the methods section, and Zach, who helped to obtain the images. And those are my references.